Today we are going to discuss fat-soluble vitamins and deficiencies. Key points to remember: the deficiency of fat-soluble vitamins are vitamin K deficiency causes bleeding, vitamin A deficiency causes night blindness, while vitamin D deficiency causes osteomalacia and rickets, and deficiency of vitamin E causes less fertility and peroxidation of lipids. You can remember fat-soluble vitamins as K. Moving to detailed discussion of deficiency of vitamin K. Vitamin K1, also called phylloquinone, which is obtained from vegetable oils, green leafy vegetables, such as cabbage, spinach, and cauliflower. So a decrease in dietary intake causes vitamin K1 deficiency. Vitamin K2, also called menaquinone, synthesized from flora of the large intestine. So, a decreased level of bacteria in the gut, for example, due to long-term antibiotic therapy, and newborn babies have sterile guts and cannot make vitamin K initially. As we have discussed in our previous video of vitamin K is required for the carboxylation of coenzyme glutamate residues of blood clotting factors 2, 7, 9, and 10. Carboxylation activates clotting factors and thus clotting cascade. Anticoagulants, such as warfarin, inhibits vitamin K. So this is a pharmacological cause of vitamin K deficiency. Hemolytic disease of newborn is a coagulation disturbance resulting from vitamin K deficiency and consequently impaired hepatic production of factor 2, 7, 9, and 10. It classically presents in the fourth day of life with gastrointestinal bleeding. Usually, the bleeding is minor, but can also result in major hemorrhage and death. So we have discussed causes of vitamin K deficiency and that are decreased flora of large intestine, anticoagulants, and hemolytic disease of newborn. Let's move towards clinical features, as we have understood the vitamin K has a role in bleeding, so its deficiency can cause bruising and bleeding, increased prothrombin time. Prothrombin time evaluate the blood clotting factors of extrinsic pathway, increased partial thromboplastin time. Partial thromboplastin time evaluate the blood clotting factors of intrinsic pathway. To understand extrinsic and intrinsic pathways in detail, watch our video on coagulation cascade. Moving to causes and clinical features of vitamin A deficiency. As we have discussed the role of vitamin in visual cycle, in the eye, the symptoms are progressive. Initially, deficiency causes impaired dark adaptation and night blindness. This is reversible. Severe prolonged deficiency results in xerophthalmia. It's a dryness of the cornea and conjunctiva due to progressive epithelial keratinization. Bedotte spots may be seen, which are white plaques of keratinized epithelial cells on the conjunctiva. If untreated, keratomalacia develops, causing corneal ulceration and the formation of opaque scar tissue called cataracts. This causes irreversible blindness. Deficiency of vitamin A also causes retinitis pigmentosa. It is characterized by progressive degeneration of rod and cone photoreceptors. In the skin, decreased epithelial cell turnover produces thickening and dryness of skin due to hyperkeratosis. Vitamin A deficiency may be caused by a decreased dietary intake, usually only seen in very severe malnutrition. It may also occur secondary to fat malabsorption, as it's a fat-soluble vitamin. There are several causes of vitamin D deficiency. Let's discuss these causes through a flowchart for better understanding. To understand this flowchart, have a view of our video of vitamin D. So the causes are decreased intake of vitamin D, reduced sun exposure. You can understand the importance of ultraviolet light through flow chat, as sunlight is required to convert 7-dehydrocholesterol to cholecalciferol, and decreased endogenous synthesis through decreased 25-hydroxylation in the liver, and vitamin D deficiency is also caused by decreased 1-hydroxylation in the kidney. So recall the main causes of vitamin D deficiency: decreased intake of vitamin D, reduced sun exposure, and decreased endogenous synthesis, that is in the kidney and the liver. Moving to clinical features of vitamin D deficiency. So, with prolonged, severe vitamin D deficiency, There is reduced intestinal absorption of calcium and phosphorus, and hypocalcemia occurs, causing secondary hyperparathyroidism, which leads to Fo's faturia, demineralization of bones, and when prolonged, osteomalacia in adults and rickets in children. You can remember clinical features of rickets by richitic rosary. Richitic rosary refers to expansion of the anterior rib ends at the costochondral junctions. Pigeon chest. Craniotabes. Craniotabes is a softening of skull bones that is known to be associated with a variety of pathological conditions, including rickets. Knock knees. End of long bone becomes wide, teeth delayed eruption. Skull frontal bossing and delayed closure of fontanelles. Next point we need to discuss are the clinical features due to deficiency of vitamin E or alpha-tocopherol, which act as an antioxidant. As we have discussed in our video on vitamin E through this flow chart that how vitamin E prevents lipid peroxidation by inhibiting propagation step and acting as a chain-breaking or secondary antioxidant, so deficiency of vitamin E causes lipid peroxidation. Keep this role of vitamin E in mind while discussion of clinical features in hemolytic anemia of the newborn. Vitamin E crosses the placenta in the last trimester of pregnancy. Therefore, premature infants have very small vitamin E stores. Their erythrocyte membranes are fragile and are susceptible to free radical damage, leading to lysis of erythrocytes. Children and adults, secondary to severe fat malabsorption. For example, a lipoprotein deficiency example, a beta-lipoproteinemia. Let's understand its mechanism. Microsomal triglyceride transfer protein that helps to form chylomicron in intestine. Chylomicrons are lipoprotein to transfer lipid to blood. From intestine through lymphatics, nascent chylomicron are transferred to circulation. These are types of chylomicron that carry triacylglycerol, cholesterol, and cholesterol esters. ApoB48 is major apoprotein of nascent chylomicron, and ApoA is also present. Now taking ApoC2 and ApoE from high-density lipoproteins, it becomes mature chylomicrons. Lipoprotein lipase are present on capillary walls. This enzyme converts triacylglycerol to fatty acid and glycerol. Mature chylomicron converts to remnant chylomicron, and ApoC2 and ApoA are lost chylomicron taken by liver by low-density lipoproteins receptors and low-density lipoproteins receptor-related proteins, and enzyme called hepatic lipase. So, in a beta-lipoproteinemia, there is mutation of microsomal triglyceride transfer protein, so there is no proper assemble of ApoB. Atherosclerosis is also caused by vitamin E deficiency as very low-density lipoproteins have ApoB100 and ApoC2, and ApoE, lipoprotein lipase act on it. ApoC2 will be removed and intermediated density proteins formed. ApoE will be removed and low-density lipoproteins will be formed. By removal of amino acid, glycerol, and fatty acids, it is then converted to cholesterol. If there is alpha-tocopherol deficiency, oxidatively damaged low-density lipoproteins are taken up by macrophages in the arterial walls, causing atherosclerotic plaque. As we have already studied in our previous video on vitamin E, it's a fat-soluble vitamin, so its deficiency is most commonly seen in patients with medical conditions that cause fat malabsorption. So important causes of fat malabsorption are pancreatic exocrine insufficiency, in which there is insufficient lipase to enable optimal fat absorption, as this enzyme is important for absorption of fat, so insufficient absorption of fat takes place. Other cause is cholestatic liver disease, in which there is insufficient bile in the intestinal lumen, so there is insufficient fat solubilization and absorption. And the last cause is disease affecting small intestine, in which there is insufficient intestinal absorptive area to permit fat absorption. Recall clinical features of vitamin E, and that are hemolytic anemia, atherosclerosis, and a beta-lipoproteinemia. You can remember these clinical features of vitamin E deficiency by mnemonic AAA. This was all about fat-soluble vitamins and deficiencies. Stay tuned to sqadia.com for more precise and knowledge-stuffed videos.